Assalamu alaikum. Good evening to all of you. My name is Ravi Mamtani, and I work at Weill Cornell Medical College in Qatar at the Institute for Population Health. We present to you a discussion on a great topic this evening in our Health and You Community Wellness series. So welcome to the series, and once again a reminder that the overall goal of the series is to create community awareness about health and disease. The ultimate objective of the series is to enhance self-care, reduce suffering, improve the quality of life, and increase healthy longevity. A couple of housekeeping notes. Your cameras and microphones are turned off. Use the Q&A feature to type questions and any comments that you may wish to make. Needless to say that questions will be addressed at the end of the session. And a reminder that this is not a CME CPD activity. As I said, it's a community activity where we empower you to be able to help you and help make informed decisions. And therefore, no certificates of attendance will be issued. So with those remarks in place, it is now my pleasure and an honor to introduce today's speaker and my colleague, a senior faculty member at Weill Cornell Medical College in Qatar, Dr. Moune Jabre. Dr. Moune will speak on this topic. We call it, Why Does It Hurt? Common Causes of Pelvic Pain. So before I invite Dr. Moune to present her thoughts on the subject, I'd like to take a couple of minutes to introduce Dr. Moune. Dr. Moune is an assistant professor of clinical obstetrics and gynecology at Weill Cornell Medicine in Qatar and a leader in undergraduate medical student education. Her academic areas of interest and expertise include simulation in medical education, development of medical student cognitive skills, mentoring and teaching related to human reproduction and sexual health. Clinically, Dr. Moune provides a full range of obstetric and gynecological medical and surgical services at Weill Cornell Medical College's affiliated hospitals and institutions. Her clinical and research interests include evaluation and management of ectopic pregnancy, gynecologic and first trimester obstetrical ultrasound and emergency obstetric gynecological medicine. Dr. Moune obtained her MD from Boston University and then completed residency in OBGY at Brown University Women's and Infants Hospital. Dr. Moune is board certified by the American Board of Obstetrics and Gynecology and is a fellow of the American College of Obstetrics and Gynecology and is licensed to practice medicine both in the US and Qatar. Dr. Moune, thank you so much for taking the time to be with us this evening. It's an important topic, and I'm sure the entire community in Qatar and beyond will benefit from your discussion. So with that, I welcome you, and over to you, Dr. Moune. Thank you so much.
Thank you, Dr. Mamtani, for such a lovely introduction, and thank you for including me in this wonderful series that is such a nice addition to the community. So, as Dr. Mamtani mentioned, we're going to talk about common causes of pelvic pain. Now, this is a huge range, so we'll just touch on some of the major things that are the most common, really. I have no disclosures. And let's start out with, why does it matter? So what? People get pelvic pain. What's the big deal? Actually, it's a fairly big deal. Almost a third of women worldwide have chronic pelvic pain. And this is women from really young ages, like 17, 18, all the way up to the mid 50s and so on. And sometimes that pain is severe enough that it's enough to miss work and impact daily activities. And this pain may be recurring and can over time have a pretty significant impact on a woman's life and quality of life and work and family and so on. So as we start talking about some of these conditions, I think it's helpful to understand the female reproductive system a little bit. And so I wanted to show this picture to give you a sense of where everything is. And then here's a close-up a little bit. And I'd like to explain, so this is the uterus or the womb where the fetus and the baby grow. And it's made up of two parts. There's this lighter pink area that you see here. This is a muscle layer that is involved in the contractions during delivery and even like a little bit of the cramping during periods. And then this darker layer here is the part of the lining of the uterus that grows in expectation of a pregnancy and then is shed during the menstrual cycle. And that becomes important in a little bit as we talk about some of these different conditions. This is the ovary, which is going to produce an egg in most women on a monthly basis. And then that egg travels through the fallopian tube into the uterus. And then if a pregnancy occurs, it implants and starts to grow here. And then this is the cervix, which is the opening to the uterus that leads to the vagina. So in addition to the reproductive organs in that part of the body, there's also all of the gastrointestinal organs. And so you could see how a problem or a disease in one area in either the GI system, the gastrointestinal system, or the reproductive system could cause pain in kind of the same area. And then on top of that, we also have the urinary system that's also in the same area. And so bladder pain can often cause pelvic pain. And so sometimes some of these conditions are difficult to tease apart because it's hard to tell which system is causing them. So I wanted to start first with some of the causes of sudden or acute pelvic pain. And here's a brief list. Again, we're not going to get into everything because we'd be here for hours. But pregnancy, infection, ovarian cysts, and something called ovarian torsion, which is a twisting of the ovary. We'll talk about that in a minute as well. And then remembering we have these other systems. So some non-gynecologic causes include things like appendicitis, constipation, gastroenteritis, which is an infection of the large intestine, and even just UTIs and other bladder problems. So one of the first things, one of the most common reasons for women to have pelvic pain, and this can be either sudden or a little bit more chronic for the length of the pregnancy, is pregnancy. When a woman is pregnant, as that baby is growing, there's a lot of changes to the musculoskeletal system, to the pressure and the strain that's put on muscles and joints and the bones. And there's actual changes to the axis or the spine that can cause tremendous amounts of pelvic pain. Unfortunately, it's all part of the normal pregnancy process, but that doesn't mean it's not painful. So you can see here, especially some of these joints towards the lower back. And then as this baby is pushing forward, you can start to feel some pain in this region as well. Now that's with a normal pregnancy, but you can get pain with an abnormal pregnancy as well. So normally the embryo or the growing baby implants inside the uterus and starts to grow inside the uterus. And this is where it belongs. That's where it's meant to grow. But sometimes for various reasons, that embryo, which needs to have the egg travel from all the way here to in here and start to grow here, sometimes gets stuck along the way and ends up growing either on the outside of the ovary or somewhere in the fallopian tube, or even in just strange places within the uterus, but that are not meant to be able to hold a pregnancy. And in this case, the pregnancy starts to grow a little bit, but can actually rupture, cause tremendous amount of internal bleeding, and is quite dangerous and can be life-threatening and requires surgery. So really, or medication, but is an important reason to go see your doctor if you're having pain when you're pregnant. Now, another common cause of pelvic pain that's sudden is infection. And one type of infection is called pelvic inflammatory disease, where bacteria can get into the uterus and into the fallopian tube and cause a lot of swelling and inflammation. And again, caught early, it can be treated with antibiotics, but sometimes it can progress and become quite severe and may need to, in some cases, have surgery because it can cause a full body infection if it's not treated. Now, ovarian cysts are something that's very, very common. And part of the reason that they're very common is because they're actually normal. Every woman, as part of the ovulation process, when she's having her periods, when that egg is made, it leaves behind a small cyst because that cyst grows in the ovary for a little bit and produces hormones that are necessary to support a pregnancy if that pregnancy happens. However, if there is no pregnancy, then that cyst dissolves and then the period happens. And then this all happens again the very next month. But sometimes those cysts don't go away quite as quickly as they're supposed to, and they can grow a little bit bigger, and then kind of like a little water balloon, they sort of burst, and that can cause some pretty intense pain that usually resolves after several days, but is pretty painful in the meantime. Now, ovarian torsion, I mentioned earlier, this is a big deal. So if you see here on this side, which is the normal side, this ovary is connected to the rest of the body through a small tube, if you will, that has all of the blood vessels, the arteries and veins that go to this ovary. And sometimes the ovary can twist on itself, like you can see here. And when it does that, it's like as if you're twisting a garden hose, and that blood flow, or in the case of a garden hose, the water flow just stops. And then the ovary is not getting the oxygen that it needs to thrive and survive, and it actually starts to die. And unfortunately, the only treatment for this is surgery, so that we can untwist the ovary and make sure that it gets that healthy blood supply back. So let's talk now a little bit about the causes of chronic pelvic pain. And these include dysmenorrhea, fibroids, endometriosis, ovarian cysts again. We'll revisit those, in cancer. And we'll talk about each of those in a second. But remembering again, we've got all the non-gynecological things to consider, and constipation, our old friend, comes back, irritable bowel syndrome, diverticulitis, which is an infection of the large intestine. And once again, you can have chronic inflammation and infections of the bladder that cause chronic pain, just like you can have acute infections that cause sudden pain. So to start out with dysmenorrhea, this is the medical term for painful periods. And it's severe and frequent cramps that happen during the period, which can sometimes feel like an awful kind of twisty pain that's really very, very difficult to cope with. And if you remember at the very, very beginning, I talked about how there's these two layers. There's this darker layer, that's the lining of the uterus. That's the part that grows and is shed in the menstrual cycle during the period. And then there's this lighter pink layer that's made out of muscle cells. And that has a little crampy effect. It has to cause a little minor contraction during the period as part of the normal process. But sometimes those normal muscular contractions are intensely painful. Some women have very mild period pain and it's not bothersome and they go about their daily lives. For others, it can be pretty intense and again can cause them to miss work and affect daily activities. The treatment for that is hormonal medications that can help regulate the period or stop the period. And sometimes it can also just be pain medication to control the pain symptoms. Now here I wanted to talk about fibroids, which is one of the most common causes of chronic pelvic pain. And remembering again that this is the muscular layer, sometimes the muscle layer just kind of grows a little bit abnormally and causes these masses that we call fibroids to develop. And they can form in lots of different places. They can be kind of here, like close to the inside. They can be smack dab in the middle. They can even be on the outside, and they can get pretty big. Like some of them, I've seen them this big. And sometimes there can be a whole bunch of little ones, but all collectively together can make the uterus quite large and painful. And they can cause a variety of symptoms. They can cause heavy bleeding during the periods. They can cause bleeding between periods, and they can also cause painful periods or sometimes pain even between the periods, just kind of constant pain. So the treatment, these are extremely, extremely common. And actually some studies have shown that if you just take a whole bunch of women, whether they're having symptoms or not, and do ultrasounds on them, close to 80% of women have fibroids. But luckily, not nearly that many actually have symptoms from the fibroids. And these are not cancerous. So that's also a really good thing, since considering how common they are. They can be treated in a variety of ways. Some ways include medications, there's some surgeries, and there's a few other procedures as well that can be considered. And it all really depends on whether a woman is planning to have children or is not planning pregnancy in the future, and the severity of symptoms and the size of the fibroids and all of those things. Now, this one's a little bit more complicated, so I'm going to take a minute to talk about this a little bit more. So this endometriosis is very common and tends to happen in slightly younger women. So we tend to see this more in women in their 20s and 30s even. And if you remember, we have this inner layer that is the layer of cells that are lining the uterus that grow in response to the hormones secreted by the brain that are signaling the body to ovulate and to have a period and so on. And so they grow in response to this. And then when there's no pregnancy, they kind of come out, and that's the period. But for a variety of reasons, sometimes these cells, which belong on the inside of the uterus, make their way to the outside of the uterus and go and end up in places where they don't belong, like on the outer surface of the uterus, on the fallopian tubes, or on the ovary, or even on the intestines or the bladder, for example. And when they grow there, they are responding to the hormones that are being sent by the brain to signal these cells just the same way. So they try to grow just like these cells are trying to do and are supposed to do. But unlike these cells, which can leave the body during the menstrual cycle, cells on the inside in the wrong places don't have anywhere to go. So they end up kind of growing and collecting and causing chronic inflammation, because blood is very irritating to tissues in the body. And when there's chronic inflammation, after a long time, it can cause scar tissue. Scar tissue can start to involve nerves, which can then cause pain. And so you end up with a chronic pain syndrome. This is actually pretty serious as well, because it can lead to problems like infertility, as well as chronic pain. So the treatment for this, once again, is hormonal medications or surgery, depending on what the plans for future pregnancy are and the severity of the symptoms. Now, I know we talked about ovarian cysts earlier as a cause of sudden pelvic pain, but sometimes the cysts don't rupture right away, and they actually just keep growing and growing and growing, and they can also get really large, to the point where it almost feels like a woman is pregnant, because it's the ovary can get so large, or the cyst can get so large, that it takes up space and causes a constant pressure and pain symptom. And these can be filled with water, like a fluid. They can be filled with a mucousy type substance, and sometimes they can be filled with blood, especially because that endometriosis, if it grows on the ovary, sometimes can continue to grow and eventually just forms like a sac that's filled with blood, and that's called an endometrioma. So these ovarian cysts, as they get bigger and bigger and persist for a long time, can cause significant pain. And then lastly, I wanted to talk about cancer. Now, ovarian cancer is unfortunately somewhat common. It has a 1 in 70 lifetime risk. So what that means, that over the course of their lifetime, 1 in 70 women will get ovarian cancer. And ovarian cancer is a little bit of a hard cancer to diagnose, because some of the early symptoms are very not specific to ovarian cancer and can be seen in a variety of other diseases that can sometimes lead to a delay in the diagnosis, or even a delay in the woman going to see her doctor, because she kind of doesn't really think that the symptoms are all that important at first. Why? Well, because some of those symptoms are like a little bit of mild constipation, possibly a little bit of pain that comes and goes, maybe some nausea, maybe a little bit of change in appetite, but these all are symptoms that can be caused by so many diseases. And so many times they come and go that it may take a long time before a patient seeks medical care. And even when they do, sometimes it can still take a long time to get to that diagnosis. Once the diagnosis is made, then it can be treated in a variety of ways, depending on how advanced the cancer is, whether it requires chemotherapy or surgery, and what type of cancer it is, and so on. So the real message of this talk is that if you're having chronic pelvic pain, or even sudden pelvic pain, it is not necessarily normal. And it's definitely not something that you just have to deal with and get over and move on with your life. Absolutely not. We really want to try to figure out with you what is causing this, because sometimes they can be mild, the pain may not necessarily be mild, but the disease causing it may be mild, and all we have to do is watch it. But as we just saw, some things can be fairly serious, and sometimes they even require emergency surgery. So the most important thing is to go talk to your doctor and try to figure it out together. We have great doctors here in Qatar in lots of different institutions and places, but I did want to mention that specifically, there's also pelvic pain clinics and chronic pain clinics. So Hamad has 2 chronic pain clinics that I believe one is in Waqra Hospital and one is in Hamad General. And then Sidra has a relatively new chronic pelvic pain clinic as well. And for both of those, you can get a referral either through PHCC or through your general doctor, or for SIDRA, you can just call up their main number and request to be seen. That's all I have for you guys today, because I wanted to leave enough time to be able to address questions and chat about it. So please let me know what you want to talk about. But before, I just wanted to show this one last picture because, you know, I'm a little bit of a science geek and I just think that this is quite pretty. So this is also an ovarian cyst, but if you notice, it's a little different from the last one. It's got lots of little pockets and it's more complex and complicated. And this one is a little bit bigger than the last one, but I think it's a cool photo, so I wanted to share it.
Thank you, Dr. Moune, Jabre. Excellent discussion. You summarized it so nicely.
Thank you.
And absolutely wonderful, and we appreciate your remarks. So can we maybe begin with some questions? The community is always interested in seeking guidance from experts such as yourself on a problem that is quite common. And I think you mentioned it, and before we began, I talked about the prevalence of pelvic pain. As an epidemiologist, I'm aware the prevalence is somewhere around 15–25% in the age group 15 to 50. Now, that to me is quite a significant percentage of people and women who suffer from it. So clearly pelvic and or abdominal, and I'm saying both because sometimes people may not be able to discern one from the other. I mean, they're quite common. Can you summarize when should, I mean, a lot of these pains that women get are common, such that, you know, it's going to happen and then go away, is the feeling that many women have. But is there anything that you can tell us that should prompt somebody who's suffering from such pain seek care right away? Can you provide us some tips or guidance on something like that would be beneficial to the community? Thank you so much.
Sure. Well, at the very minimum, I'm going to break it down into first like the sudden pelvic pain and then the chronic pelvic pain, because they're slightly different. But for any new sudden severe pelvic pain that is more than like you feel comfortable just sort of sitting around and going about your daily business, and if it's really starting to impact and it's noticeable and it's sudden and it doesn't just go away on its own after about an hour or so, then I would wonder what's going on and might want to keep an eye on it. And if that pain starts to increase or becomes associated with a fever, with any other symptoms like significant diarrhea or pain that spreads to other areas, nausea, then those would be reasons to, or dizziness even. And, you know, dizziness is one of those things where people might not think that they would even be related. But if there is like a ruptured cyst, for example, or a ruptured ectopic pregnancy, those can cause a lot of internal bleeding. And when there's a significant amount of internal bleeding, that can drop the blood pressure, which can then cause dizziness. So sometimes it's a bizarre symptom to think about, but those would be reasons why I would want to get care with acute or sudden pelvic pain. And a lot of times, I understand that a lot of times women are going to go to the hospital and they're going to have a normal checkup and it'll be ultimately okay. And that's great. Sure. Is it going to feel like a waste of your time? Absolutely. But I would honestly prefer a waste of your time and know that everything is okay than to miss something that's potentially dangerous or could have been addressed sooner rather than later and would have better outcomes if it's addressed sooner rather than later. So that's for the sudden pelvic pain. The chronic pelvic pain, I think, is a little bit trickier because by the time it's become chronic, patients have like learned to live with it and have clearly not had any, sudden severe complications from it because, you know, they've allowed it to get to this point where they've had it for months or sometimes years even. And I think that one's a little bit harder to go to the doctor for because a lot of people are just like, well, you know, I've lived for years with this. It's fine. What are they going to do? And you would be surprised. Many times there's not a lot that we can do to fix the problem, but we can actually do a lot of interventions to help cope with the pain or manage the pain to make it less burdensome. And everyone deserves to live their best and most healthy life. So with chronic pain, if you're having it, if it's bothersome, if it's affecting your life, go see your doctor. Try to figure out what's going on. I mean, that one is sort of a little bit more simple, but 100%, if chronic pain changes and starts to have fever, worsening pain, sudden other associated symptoms like nausea, etc., that should also prompt going to the doctor, because sometimes these chronic symptoms can have sudden complications and would need to be evaluated then.
Well, indeed, and very educational response, Dr. Moune. Thank you so much. And here's a related question. The question is, I'm told to go see my doctor once a year. There are others who say I should go every 3 years, perhaps once in 3 months. And I think related to what you said, would you recommend a certain visit to my OBGY at periodic intervals, and what would that interval be? Can you give us just broad guidelines on that, please?
Absolutely. So those guidelines change a little bit depending on the different times in a woman's life. A young girl may not need to see a gynecologist very frequently. Somebody who's reproductive age should see them a little bit more frequently. And then somebody who's postmenopausal probably needs to continue to see them a little bit more frequently, but the reasons why change a little bit. So I think that for most women who are average risk, that means like they don't have any specific complications, they don't have any specific conditions, just your run-of-the-mill average healthy woman, at minimum should see her gynecologist every year. Because during that year, during that annual visit, we do a lot of preventative health care. So we want to check and make sure that is there a need for cervical cancer screening? We do screening for breast cancer. We can check in and make sure that you're not developing pain that maybe you haven't mentioned to your doctor, or some other symptoms that sometimes to people not in medicine may seem like insignificant, but we might pull them together and say, you know what, I do kind of want to check that out. Maybe you're a little bit anemic. And so there's a lot of different small things that we could pick out and optimize a patient's health. So minimum once a year is really essential for maintaining good health. And then, some women who have other conditions may need to be seen more frequently, but for an average, typically healthy woman, once a year should be good.
Thank you so much. So here's another good question. Any guidance on how young teenagers or young women can deal with and cope with the period pains that occur on a monthly basis? Any general guidance? I mean, there are plenty of people, I'm sure, who experience it and may suffer every now and then. Any guidance on that, please?
Yeah. So unfortunately, a lot of teenagers, as they begin their cycles and start menstruating, for the first several years of menstruating, they can sometimes have more significant pain that eventually kind of tapers out as they reach later reproductive life. But in that beginning time, it can be much more painful than typical. I would say, number one, that was something that would be really helpful. Obviously, go see your doctor, because I think we need to make sure that it's nothing but period pain, because there's a lot of things that could be causing pain. And before we just say, oh, it's just period pain, let's treat that, we want to make sure we're excluding anything that could be more dangerous than that. And we can only do that if the patient is being evaluated. So that's number one, is go see the doctor. But step one before going to see the doctor that actually makes that doctor visits more helpful is to do something called a menstrual chart. And this is that you can find them online, lots of different places, just as a free tool that you can print out. And it looks like a calendar. And we would have the young woman write out on the calendar. There's usually like symbols that she can use about when she's getting her period, how heavy is the flow, when she's getting any associated pain, any other symptoms like maybe headaches or migraines, nausea, mood changes, and we just kind of put that all in the calendar. And if the patient can get that for a few months, like 2 months or so before going to see their doctor, not that it should delay seeing the doctor, but if they're contemplating whether or not to see a doctor and can start tracking this, then when they go see their doctor, it can be very helpful to have that, because then we can look at patterns. And sometimes the patterns are very telling as to what could be causing the underlying problem. Beyond that, Panadol, in some patients, ibuprofen, but not everybody's allowed to take ibuprofen. So this is really why it's important to get the doctor first. And there are other medications that can be used to manage the pain or to stop the pain in the first place by controlling the hormone cycle. So there's different ways to manage it, but number one is go see the doctor and make sure that it's nothing more serious than that.
Thank you. Thank you so much. There's a question on, and a comment, I guess, on raising women's awareness on commonly occurring problems, such as the one that you described. I mean, while we at the Institute for Population Health, as you know, at Cornell do that, we engage in a lot of activities, we do things to raise awareness of commonly occurring problems, and your discussion this evening is a case in point. But is there anything that, from your standpoint or from the standpoint of gynecologists who deal with women's health, is there anything else we can do to raise the awareness of women in communities about problems as similar to the one that you just described, chronic pelvic pain, from your standpoint, that you feel community could benefit from?
Yeah, I think there's a lot of value to public awareness campaigns, and we've seen lots of them recently about cervical cancer, breast cancer, depression, lots of different things. And I think that similar public awareness campaigns about this kind of stuff is very helpful. And just in general, I think understanding about reproductive health, the menstrual cycle, the development of the reproductive system, et cetera, is helpful for women to understand, just in general. Whether that education can be incorporated into like schools at adolescence, it varies, or that can be done as part of the community. But I think there's always value to public awareness campaigns. And then some of that onus also falls on us as physicians when we're seeing patients, and not just in gynecology, but in all of the primary care fields, that we have enough knowledge about these things to be able to refer patients to the right resources and to help inform patients as well.
Dr. Mamtani, can you hear us?
So it looks like he may be frozen, but I do see in the chat here that there's one other question that I'm happy to address in the meantime, which is, does lifestyle play an important role in the severity of pelvic pain? And it can, depending on what the cause of the pelvic pain is. There's some things where lifestyle doesn't really impact it. It is what it is. Right. But certainly with things like dysmenorrhea and period pain, women sometimes have triggers for it. Like some women notice certain foods or certain activities can exacerbate it or make it worse. And then that's where that calendar really helps, because it allows not just the physician to pick up on patterns, but for the woman to pick up on pattern and then potentially change those behaviors. Some women find exercise is really helpful at decreasing pelvic pain. So they can impact it depending on what the underlying condition is.
Excellent. Thank you so much. You make a good point about what I call as a logbook. Make notes and see if there are correlations, because in evaluation and management of your patients, as we know as physicians, that such a logbook can be extremely helpful. And I think you make a good point about the lifestyle, and there was a question on that. So thank you for answering that. Sure. There is plenty of information available. There's a question on, do we make these sessions and or other information available to the community? We do, and Raji can comment more on that. But if you were to go to our website, which is the Institute for Population Health at Weill Cornell Medical College in Qatar, we have plenty of resources, plenty of write-ups, that can be helpful to the community at large. Raji, do you have a comment on that in terms of the resources that we make available to the community?
Yes, Dr. Moune. So we will post these videos on the website. We will have our community website in place. So the information will be available there. Also, the videos we do post.
Okay. All
And I
right.
would also like to add that both the, I'm US trained, so I don't know as much about some of the resources that are available in Europe and Australia and New Zealand. However, the American College of Obstetricians and Gynecologists, as well as the Royal College in the UK, both have patient information. So if you just Google RCOG or ACOG, patient resources, it'll take you to the page for the American College and the Royal College of OBGYN, and they do have a lot of patient resources on many of these diseases.
Thank you. There is one more question, and I know we're running out of time, but maybe one more question. There's a question about the specific causes for chronic pelvic pain among non-married young women. Any thoughts on that, Dr. Moune?
Yeah, absolutely. So pretty much everything that I described can happen in women who are sexually active or women who are not sexually active, aside from pregnancy. So the ectopic pregnancy and the pregnancy in a non-sexually active woman is not going to be on my list of diagnoses to consider, but everything else, the ovarian cysts, the inflammatory disease, the endometriosis, the fibroids, all of those can happen in non-sexually active women.
Well, thank you so much.
Somebody just put, Raji, thank you for doing that. I think that you put up the RCOG website on the chat. Thank you.
Yes, yeah. So that's been wonderful, Dr. Moune. You answered some very complex questions, translated them into the language that the community understands. And I think that's important. That's the purpose of these discussions, to be able to share information so that the public can understand and empower themselves to further improve their health. So with that, our gratitude to you. Thank you so much. And we appreciate your remarks this evening.
Thank you very much, Dr. Mamtani. And again, thank you so much for including me in this wonderful series. I truly appreciate it.
No, and I want to thank all the participants. Hopefully you will stay in touch with us and join us in other future events that will follow. So thank you so much. And
thank you. Good night.
Thank you.
Thank you.
Have a good evening.